The Lynch Foundation has been around for 35 years. It's a family foundation that has invested in social entrepreneurs over the last 3.5 decades that have literally changed the world in a global way. From Teach for All, which was started at Teach for America, our Partners in Health, started by Dr. Paul Farmer. And so when we were introduced to ICHOM, we were excited about, the opportunity to change the world in a global way that creates better outcomes for patients and the medical professionals and the world, frankly. I think it's phenomenal to see over 650 people globally from all around the world sharing ideas and innovations that I think can influence and help us all change the world to be a better place. I think what I've taken from the conference is there is so much that is available for us to take lessons and learning from different countries who have had the ability to be a little bit more innovative than the United States on creating the experience and change that is beneficial to the patient, to the hospital, to the nurses, the doctors, with huge financial implications and much more positive experiences for all involved, from the medical professionals to the patients themselves.
Well, to me, it was interesting they talked about all the clinicians, whether it's a physical therapist, a nurse, occupational therapist, not just a physician, person actually meeting with a patient and actually listening. They kept stressing, listen. They know much more about what they want, what the condition is. Stress here, you're not going to get better outcomes unless you find out what the issue is, what their goal is, what's their objective. It's so patient-centered. Excellent.
I completely agree. I mean, I think the idea of it is so practical and thoughtful. Listen, and listen again, that the expert is the patient that's experiencing their sickness, and we all experience it in a different way. And so it's taking the time to really think about what's the best outcome for that individual patient, and having all different medical professionals being involved in integrated care for that individual. I think it's phenomenal.
A better outcome is good for everyone, and this works. It really works. It works in Saudi, it works in the Netherlands, totally different countries.
I agree. I think it's an understanding and a different incentive for the United States to understand that the better that we can care for the patient, the outcomes for everyone involved. So not just for that individual, but for the, again, medical professionals that are working to support that person, feel better about their work, feel better about themselves, feel better about taking care of their patient better. Besides the financial implications, it is just a better experience for the patient and the doctor and the nurses and everyone involved in that care. I think some of the incredible examples we heard today from the Netherlands, the pulmonologists, and understanding sort of the interventions and understanding what the patient wants out of that care, and how to deliver that care in a much more effective, thoughtful, kind, supportive way, I think has been extraordinary. I think there's been incredible interventions that we've heard about today.
Well, throughout Asia, Hong Kong is totally different than Malaysia or the Philippines, and I think they're making progress on patient outcomes. That's remarkable to me. And the difference between China and the Netherlands, wow.
I think the more knowledge and information that's shared, it's so empowering to the healthcare professionals to know that there's a different way to deliver and support and care for their patients. I think allowing them to know that it's okay not to be the expert and not to have all the answers, and that this is a journey together with their patient, I think it could be incredibly transformative and empowering.
It's so amazing now, the amount of scientific articles. Really, these are major cases. It's up 50-fold from just 15 years ago on outcomes, and that was not existent. So maybe this will appear in the New England Journal of Medicine. Maybe it'll be in Nature. Maybe it'll be in Lancet. So everyone will hear about this. They'll talk about it.